Hey everyone, thanks for tuning in and welcome back to Effective Exercise. Stephen here with Team Euphoric, and today I'm going to be discussing how both practitioners and patients can optimize their health and performance by going over the CHEK totem pole. The ninth and final item on the CHEK totem pole are the slave joints. The slave joints include the joints of the arms and legs. These joints are influenced by the systems above them on the totem pole. If there are issues higher up, they can affect the function and health of these joints. Addressing the higher priority systems can help alleviate problems in the slave joints and improve overall movement and function. Now I'm going to be taking you through some assessments to assess the various slave joints. These first ones are going to be very general assessments. We're not really going to get too specific, and they are ones that I use regularly in my physiotherapy clinic. The first test is going to be Apley Scratch, and this is a general test for the shoulder complex. The Apley Scratch, it consists of 3 different parts. The first part, we are assessing horizontal adduction as well as medial rotation. And what you're going to do is just have the client reach up and over to the opposite shoulder. And then this isn't part of the Apley Scratch, but you can also do it while you're here, is an impingement test. So you would just have them raise their arm up to the sky and then come back down. If they raise their arm and they feel pinch or pain in the shoulder, then if you are qualified, you would want to treat it, as there could be some underlying condition in the shoulder. If you're not qualified, you can refer them out to a specialist. But that's part 1. Part 2 of the Apley Scratch test is we are focusing on flexion, external rotation, and abduction, abduction. You want to take them through flexion, external rotation, and then touch the superior border of the opposite scapula or shoulder blade. If they are able to do that, the third part is going to be the extension portion of the Apley Scratch test. For this one, we're going into extension, medial rotation, and adduction, a deduction by touching the fingers to the opposite inferior angle of the scapula or the shoulder blade muscle. So that is the Apley Scratch test. If they are able to do that, they pretty much have the go-ahead to do strengthening exercises because their range of motion is pretty good, so you're not really going to be too restricted. Then, at the hip joint, a few of the assessments that we can perform, my standard go-to assessments are going to be the Thomas test, Ober's test, and the Faber's test or the Patrick test. With regard to the Thomas test, you're going to have a client or patient get the edge of their butt to a massage table, lay back, hug one knee to their chest, and relax the opposite leg. What you're looking for, first thing, is you want to take a look at the greater trochanter and the lateral condyle of the femur and see, for men, are they in a line? And for women, is the lateral condyle below the level of the greater trochanter? That's going to indicate that they have good length tension relationship in the psoas or something like the rectus femoris. If they happen to either be parallel for women or higher for men, then what you would want to do is passively extend the knee. If you extend the knee and the leg sinks down, then you know that the tension isn't in the psoas major, rather it is in something like the rectus femoris, because the rectus femoris not only attaches to the patella, but it also attaches to the anterior inferior iliac spine, or the AIIS. But that is one thing to look at. The next thing you're going to look at, aside from the psoas, is you're going to look at the knee. So you want to see the ankle. Is it directly below the knee, or is it extended out? If it's directly below, that's what you want to see, and that means good length tension in the rectus femoris. If they are on the table and their leg is extended out, then that could indicate that they have tension and tight rectus femoris muscles, and you would want to stretch those muscles out. Then you would want to also look at any type of lateral or medial deviation. So ideally, the patella and the anterior inferior iliac spine should be in alignment. If the leg is way out, then that could indicate tension in the hip abductor, so muscles like the gluteus medius, minimus, or the TFL. If the muscles are coming in, or if the hip is going in, then that could indicate adductor tension in the various adductor muscles. And then the last thing you would want to look for is the ankle directly below the knee, or is it laterally rotated or medially rotated? If the ankle is outside of the knee, then that would indicate that the medial rotators of the hip are going to be very, very tight, and you want to stretch those out. If the ankle is inside of the knee, then that could indicate that there is a lot of tension on the lateral rotators, such as the deep lateral rotators of the hip, like the quadratus lumborum or the superior and inferior gemellus muscles. And you would want to do some strength or some stretching and strengthening on the various muscles to help bring some uniformity into that hip. With the Ober's test, you would have the patient lay down on their side. You would have The bottom leg is flexed for stability. The top arm, they reach up and over to the corner of the massage table, and then you would bring their hip into extension and knee flexion and see if they could bring their knee down toward the table. If they can, they have good length tension in the muscles such as the TFL and the gluteus medius and minimus. If they can't, those muscles might be very tight and you may not need to work on those. And then the last test is going to be the Faber's test or the Patrick's test. This is an easy one to remember because Faber, F-A-B-E-R, you're doing flexion, abduction, external rotation. So you would have the patient lay down on their back, and this is just a general test to see if there's any pathologies in the hip. But you would have them lay down on their back, you would cross the knee over the top of the patella, and then you would just have them passively go down and see if they are able to go down without recreating any pain or symptomology in the hip. If they don't recreate any pain and there's no symptoms, then that's pretty much good. You don't really have any severe pathologies in the hip. If they do notice some pain or there's a lot of restriction, then there's some type of pathological issue going on with the hip that you would want to address. But that is just a very basic assessment for the shoulder and for the hip. You would also want to assess the elbow, the wrist, the knee, the ankle, and I'm not going to go over all of those because I have a ton of them in my assessment series playlist. If you are a member, check out that playlist, and there are 120 different videos that you can check out. If you're not a member, consider becoming a member for $5. You will have instant access to all 120 of those assessment videos. But once we have assessed the mobility, the next thing we want to assess their stability. So we could do proprioceptive awareness by doing things like single balance test, and also doing things like horse stance dynamic exercise just to assess the stability in the spine, in the hip, in the shoulders. Check out, again, just search proprioception or search elbow test, elbow assessment, proprioception assessment on my channel, and you will find those videos. Once we've assessed the proprioception, the next thing we're going to do is assess strength. For the strength, we could do muscle testing. So for each muscle, for example, the gluteus medius is responsible for abduction. So to test it, we could take them into abduction, apply a downward pressure, and they should be able to maintain good pressure. When you are performing this type of assessment, any type of muscle testing, you want to match the patient's pressure. So if you are 7 feet tall and you weigh 400 pounds, and then you have a patient that's 4'9", 70 pounds, you're not going to give a whole lot of pressure because the patient is very, very small. So you want to give a good amount of pressure relative to the patient's size. And then if you're a very, very small practitioner and you are assessing a very, very large patient, for example, I treat a lot of basketball players, NHL players, NFL players, so I have some very big individuals. I have to put a lot more pressure on them as opposed to if I'm treating a 60, 70-year-old patient for various conditions. And then once we've assessed the client or patient's mobility, stability, and strength, the next thing we're going to do is assess their movement patterns. For the movement patterns, we're going to assess the primal patterns. So push, pull, bend, lunge, squat, twist, and gait pattern. Again, I'm not going to go over all of those because it's going to take way too long for this video, but check out the assessment playlist or just check out any of those patterns in my videos. Once we've done the assessments, next we are going to move on to some exercises. So to work on the slave joints, first thing we want to do is mobility. So with regard to the mobility, you could end up doing stretches. These are going to be your myofascial stretches and your joint mobilization exercises. So for the joint mobilizations, you want to have one arm where you are fixing the joint, and then one is going to be the mobile arm. So you have the stable arm, the mobile arm. With the mobile arm, let's say you wanted to work on the patella, you could brace with one hand below, and then with the hand below, you are going to move the patella side to side, up and down, so superior, inferior. And then with regard to the myofascial stretching, I have tons of videos in my exercise series playlist that I'm not going to go over right now, but regardless of whether or not you're a member, just search myofascial stretching and you will have access to all of those, or search my mobilizations and stretching playlist. Once we've worked on some mobilization, the next thing we're going to work on is stability. For stability, same thing. I'm not going to go over all of them, but just search proprioception exercises on my channel for dozens of proprioception exercises. We have proprioception exercises for the ankle, for the knee. We have them for the hip, the lumbar spine, thoracic spine, shoulder, elbow, everything. So go ahead, search those. Once we've worked on proprioception, the next thing we're going to focus on is strength training. With regard to strength training, we are going to just do your standard training. So this could be your pushing, pulling, bending, lunging, squatting, and twisting. Whenever you push, you're going to be strengthening your chest, your anterior deltoid, your triceps. Whenever you pull, you're going to be strengthening your back muscles. You're going to be working on the posterior deltoid, your biceps. Whenever you are doing any type of squatting motion, you're going to be working on the core down with an emphasis generally on the quadriceps. Any type of bending or hip hinging movement, Same thing, core down. We're also working on some upper back if you are holding a weight in front of you, and we're emphasizing the lumbar spine, the glutes, and the hamstrings. For lunging, similarly to the squat, it's core down, and we are primarily focusing on the quadriceps muscles, depending on what type of position we are in. If we are doing something like a front foot elevated, then we'll also target a little bit more the hamstrings and glutes. And then whenever we are focusing on twisting motions, we are focusing on the deep core muscles and also the superficial core muscles, such as the rectus abdominis, the external obliques, and the internal obliques. But those are just a few ways that we can work on the actual slave joints. And if you found this video helpful, leave a comment. And if you need a little bit more advice, let me know where exactly you are stuck so I can help you guys out. Thanks for sticking around until the end of the video. Be sure to like, share, and leave a comment as it'll help the algorithm. And if you enjoyed the content, show your support by subscribing to the channel by clicking on the icon in the bottom right corner. And if you really want to show your support, then consider becoming a member by clicking on the icon in the bottom left corner. These new high-quality videos aren't cheap to edit, and the $5 membership will really help with the video editing budget. You'll also get access to a ton of exclusive perks like early access to videos and this program design lecture playlist in the top right-hand corner. And if you want to learn how to do a one-armed pull-up, then check out the playlist on the top left corner.